Hey guys, welcome to Total Health Live with Dr. Sedano. I am Dr. Nick Sedano, and as usual, I am so thrilled that you could be here with me today. I know you've got a lot of stuff going on this time of the year, maybe Christmas shopping, getting errands done, but I'm glad you're here with us this morning because we've got a great show for you. How many of you experience children with ear infections? Many, many of you do. In fact, type into the little comment bar, say yes if that's you. If your heart breaks every time your child wakes up in the middle of the night, screaming because of their ear draining, maybe fluids all over their pillow, you're exhausted by the morning time because you've been up all night with your child. If this is you, maybe you're struggling with ear infections. Maybe you're tired of all the different rounds of antibiotics, the prophylactic rounds of amoxicillin and so on, and all the different things you're giving to your child. And you're just tired of your heart breaking every time you wake up in the middle of the night to hear your child screaming. Well, this is for you because we have gotten really, really great results with ear infections, and I wanted to share this with you today because I know there's so many of you out there that are struggling with this. You don't know what to do, you don't know where to turn, and as usually, you know, we try to be the voice of truth when it comes to healthcare and make the most complicated decisions simple, to really break this down and to tell you really where the ear infections are coming from, because I truly believe you're getting a lot of misinformation. So this hopefully will shed some light on it, give you some different options to do, and really what works for us in our practice. And I've been in practice 26 years, and this has worked, I'd say, almost 100% of the time. So once again, if this is information that's important to you or your friends, like this, share this out, get your friend on the line right now so that they can see what's going on. In fact, I'm going to put on my phone to see if there's anybody with any questions. I'm always going to be watching out for you guys to make sure if you have any questions, just let me know. I'll see if I can answer them on the line now. If not, make sure you type them into the comment bar, and I will certainly be able to get them answered. If you're watching this show long after I've done it, go ahead and email us. I'll give you the email information at the end of today's talk, and you can email me, and I'll be glad to answer your questions for you. So when it comes to ear infections, like I said, this is something that I get a lot of questions about in my practice, and we have a lot of children with ear infections in our practice. So this is something we've got a tremendous amount of experience with over 26 years, and I really believe because of the approach that we take, we really have zoned and zeroed in on what's truly causing this problem. But when it comes to ear infections, first thing I want to talk about in this part initially is really the medical approach. Now, this is not the approach that we take, but this is the medical approach, and this is probably what you're more accustomed to and what you're used to. But I want to give a shout out. Hey, Dina, glad you're on the call today. But when it comes to ear infections, 3 out of 4 children will experience ear infections. In fact, I'm going to read to you a testimonial before we even get started. This is one of the first ones I ever got in practice, and this is from as far back as 1991, so it shows you how old I am. Anyway, I remember when this child came into the office. It was a very cold Monday. It was drizzling out. It was raining. It was around this time of the year. And the mom didn't even know why she was in our office. So she said, you know what, I don't know why I'm here. My husband Gary said to bring our child in, that you can help. But honestly, I really think I need to bring Matt to the doctor, maybe one of those doc-in-the-boxes, because he's got an ear infection right now. Pus is draining out of his ear. And I think I just need to bring him. And I said, Donna, just give me a few minutes, fill out the paperwork. And by the way, I would never do this today. You know, you got to do things a lot differently today. But I said, if you don't have relief with your child before you're done filling out the paperwork, you can take him. And she said, you know what? That's a bet I'll take. Well, this is what he experienced. She wrote to me in this testimonial. She said, our son Matt began to have ear infections when he was a few weeks old. He was continually on antibiotics. And at the age of 2.5, after 13 ear infections in 1 year, he had his adenoids removed and tubes placed in his ears. So right away, he's roughly 2 years old. He's already had 2 surgeries. One to put holes in his eardrums, and the other one's to take out his adenoids, which are one of his body's first line of defense. Your adenoids and your tonsils are designed to fight infection, to fight disease, to fight bacteria, to fight viruses that get in through your mouth. So right away, you need that line of defense, and he had his taken out at 2.5 years old. She goes on to say that as soon as the tubes came out, because typically they do fall out, and a lot of times you'll find them, you'll see these little tubes. The chronic ear infections began again, so at the age of 5, he had his tonsils removed this time and tubes replaced back into his ears. So by the time he was 5 years old, he'd already had 4 surgeries. He was cut up. And none of this was actually getting to the root underlying cause of the problem. All it was doing was treating the symptoms. If you've got pressure behind the ear, let's poke a hole in it and let the fluid out. So we don't know what's really causing this problem, but we're just going to keep doing things. And then when your tonsils get infected and your adenoids get infected, because they're another side effect result of this, we're going to take those out too. Two major organs that your body uses, especially in young children when their young developing immune systems are growing, we take them out, and then right away we've got them against the 8 ball. We have their back against the wall when it comes to fighting disease because their first 2 lines of defense right in through their mouth, tonsils and adenoids are gone. So when Donna brought him in, like I said, she didn't even know why she was there. I made her a bet. I said, if I don't have him better by the time you fill out your paperwork, you could take him. She said, okay, fine. So I took him in the back, and once again, like I said, I'd never do this again. I took him in the back, x-rayed him, quickly adjusted him, and she comes into the room after filling out the paperwork, and she looks at him. I'll never forget this. She literally looks at him. He's sitting in the chair, and she said, okay, Matt, come on, let's go. I said, Donna, he's okay. And she looks at me really kind of almost angrily, and she said, no, he's not okay. I've been dealing with this for 9 years now, because at this age, he's now 9.5. She said, so come on, Matt, let's get going. And I said, Donna, really, ask him, ask Matt. Now, Matt was an extremely intelligent 9-year-old, and he looks at his mom, he says, Mom, I'm fine. And she looks at me and she says, what do you mean you're fine? She goes, my ears don't hurt anymore. And she says, you mean he's better? And I said, yeah. I said, it's over. You don't have to go through this anymore. And sometimes I get choked up actually telling this story, but she looks at me with tears coming down her eyes and she says, I don't have to wake up in the middle of the night anymore? And I said, no, it's done. Well, he came in regularly. We got him his spine corrected. And after that, he never had an ear infection ever. So I truly believe that what we teach in our office is really what it takes to get rid of ear infections. And because ear infections lead to a whole nother other problems, which we're going to get into in just a moment. But this child had 13 ear infections in his first year of life. Right over here, WebMD says 3 out of 4 children will have at least 1 ear infection by the time they have their 3rd birthday. So Matt was way ahead of the game when it comes to this. Ear infection is the most common reason parents take their children to the doctor, and it's the #1 reason why children are given antibiotics. And we're going to get into it towards the middle of this discussion, really what antibiotics do to the immune system, the body's gut. It really destroys the immune system. And if you put a child so early and young in life on antibiotics, you really set their chances up for having major diseases later on, including cancer. I want to say hello to a couple more people. We have Ken on and Alyssa. Good, glad to see you on. Dr. Janie's here, and John. Glad you guys are all on. Thanks for watching today. Not only that, medical's approach to ear infections is that, their way of looking at it is that the middle ear, the small part of your ear behind the eardrum, gets infected when germs from the nose, ears, and throat and so on get behind there. Sometimes there's a fluid buildup. A cold can cause this tube to swell. So the tube, the eustachian tube within the ear, right behind the eardrum, starts to swell. And when the tube swells enough to become blocked, it could trap the fluid in the ear. And a lot of people, we'll talk about in a little while, also believe it's because of swimming. That maybe it's due to swimming, and we're going to talk about that little myth in a little while. This makes it a perfect place for germs to grow and cause inflammation. So the medical approach really is all about that it's a germ problem, that it's a bacterial problem, that fluid builds up behind the eardrum. When that eardrum starts to, the eustachian tube swells up, it blocks fluid. Fluid sits in there stagnant, which, thinking about it, it does make sense, but it's not what's going to fix the problem. When that fluid swells up, the bacteria and germs can get in there, and then they cause an infection, and that's the medical belief to this. So once again, what we're seeing here is, here's the outer part of the ear, here's the eardrum, okay? Here's the tube, here's the eustachian tube. So as this tube fills up with water, you can see the fluid level here, it backs up and it gets stagnant. Once it's stagnant, germs and bacteria can, once again, make it infected. It causes the eardrum to then swell, so that fluid builds up, pushes the eardrum out, it causes it to swell, and many times we'll actually see a rupture or a tear or a hole in the eardrum, which ultimately then nature's way of allowing that fluid to drain out. But the big thing is this: what's causing all this upstream? What's causing the problem to begin with? Because we just can't keep blaming it on germs, and we're going to talk about that in just a moment. Why is germs not the issue here? Why is there something else that's going on with this that we need to get to the underlying cause going to truly fix their problems? So when we look at an infected eardrum, when a doctor looks through an otoscope right into a child's ear, and you'll see him put his hand on the side of their head and look through the scope into their ear, what they're looking at is the membrane of the ear, and it's actually looking, we used to, when we were in chiropractic college, it was always this angry looking red. So we would look in everybody's ears, and if you saw this angry red rather than a gray eardrum, we knew that it was infected. So this is this angry red. In fact, it can get even redder than this. And a lot of times you may take your child to the doctor and they say they see the beginnings of it. And what they're seeing is instead of a gray eardrum, they're seeing it getting pinker and pinker and redder, and that's what they're looking for. So they can usually tell you that an ear infection is coming. So even when you take your child to the doctor and you say, well, he doesn't have an ear infection yet, he's not complaining, what they're seeing is the beginnings of the pink and reddening eardrum, just so you know. With the symptoms we see, obviously, ear pain. So you might see your child tugging on the ear, or you might feel that they're trying to relieve it. And many times what we used to do to help patients is move the ear lobe so that way the tube can align better and actually drain better. But we'll see drainage from the ear. Many times you'll start to see if the eardrum has actually ruptured, pus will come out of the ear, and you may see this oozy, crusty looking stuff. That's a clear-cut sign. You might see loss of appetite. So if your child is typically a great eater, you'll start to see the beginnings of it coming because they're not going to be eating as much. They just don't want to eat like normal. You'll say, my child is just not acting right. Vomiting and fever are also signs that an ear infection is either present or on its way. They get very irritable, and of course, they have trouble sleeping. So these are clear-cut signs. And if you're a mom, believe me, I know you already know the signs. I know you know what to look for because maybe you've gone through this many times with your child. One of the big things and big reasons I say to correct the underlying cause of an ear infection is this. A lot of times our parent will say, and maybe you can relate to this, well, my child outgrew the ear infections. They just went away eventually. Here's the problem. They eventually go into another form. So the ear infections, which were once, like I said, in the form of an ear infection, will become a sinus issue, or maybe it can become a strep throat issue, or headaches. It could become other things because the area that we find that controls the ears controls all those other areas too. So many times when a child grows out of one thing, something else comes along. So I always warn parents about that. When they say, well, he grew out of it, he had it, I'll say, you know what, sinuses will be next. And sure enough, they're in the office with a sinus infection. Or headaches are next, or throat. So eyes, ears, nose, and throat are always typically connected to the same area of the body. Hey, Yadi, want to welcome you, and Bryce, glad you're on the call too. All right, typical treatments, and once again, this is what typical mainstream treatments are, typical medical treatments are. You'll use pain relievers, so medications, and of course you always want to check with your doctor to make sure that a certain medication is okay to give to a child because sometimes the dosages aren't set up for a child, they aren't tested on children, and next thing you know, a child is getting an overdose on a medication. So pain relievers are probably the number one things that people typically do. Once again, we don't do that in our office, so we'll talk about what we do, but that's what most people do. Heat, you might take a towel, a moist, warm, or hot towel, and put it around the ear. That's another thing to do. Of course, rest. The more a child can rest, the more they can sleep through a lot of their pain, if they could even do it, right? Ear drops. And ear drops can be, lots of different types of drops. Some people actually put oils in an ear. Some people use garlic oil because garlic oil is an antibacterial, antiviral, antifungal type of, has properties of. So they'll put garlic oil in the ear. So there's lots of what we call external remedies to try to fix the problem. But once again, if you're not getting to the underlying cause of the problem, all you're doing is putting Band-Aids on it. All you're doing is masking the pain and not truly fixing what's really causing it. Antibiotics are a big choice. Now, once again, I was talking earlier about these prophylactics antibiotics. The testimonial I read earlier, Donna would say, well, all I would do is either give them the white stuff or the pink stuff. And I don't know which color was which, but one was typically amoxicillin, which actually doesn't work. In fact, the AMA proved that it didn't work many, many years ago, but doctors still do it because it's almost like just protocol to be using amoxicillin for middle ear infections, but it doesn't actually work for that. It doesn't work very well for persistent middle ear infections. But what antibiotics do, up to 80% of the immune system, is what we were talking about earlier, is housed in the gut. So using your child's immune system to fight disease is first and foremost, and yet what you're doing is hampering it by giving them antibiotics because the antibiotics will actually kill the good and bad bacteria. So you want to kill the bad stuff. The problem is you're also killing the good stuff, because antibiotic by definition means this. Anti means against, and bio means life. So these are against life. And meanwhile, you're giving these to your child. And they're harmful because they severely damage the immune system. So like I said earlier, the problem we do is we start to set our children up for chronic illness and chronic disease down the road, because we're giving them things that will destroy or damage or hamper their immune system so early in life while it's in its developmental stages that we create big-time problems later on. So it's like we're trying to solve the short-term problem, but in the end, we're creating long-term problems and disease. Overuse of antibiotics contribute to more than 4 million cases of infection by drug-resistant bacteria, and more than 25,000 deaths annually in countries like in areas like Europe alone. And we see this. We're starting to see, not only that, we're starting to see the development of superbugs. The CDC has reported that there are 2 million illnesses and 23,000 deaths annually in the United States because of superbugs. So because of this indiscriminate use of antibiotics, where we just give it out for everything. In fact, many times you bring your child to the doctor, they didn't even check to see what kind of problem it was. They didn't see what kind of infection it was, and you're just indiscriminately giving them a blanket prophylactic antibiotic, when meanwhile, antibiotics only work on bacteria. They don't work on viruses at all. So if you're taking your child to the doctor and they have a viral type of infection, it's not going to do anything, because antibiotics don't work on that, but yet they're not testing for it. So bacteria, because they're so creative, they can actually become drug resistant. And that's why we're seeing these superbugs now that in many cases, antibiotics are almost food for them. They do so well on antibiotics, and yet we don't know how to kill them anymore because we're just using it. They adapt so easily to things. So next, I want to show you what tubes in your ears do. Well, before we get to a tube, this is what a ruptured eardrum looks like. So we actually see a hole in the ear. So if we're not, once again, getting to the underlying cause, we'll actually get a hole punctured through the ear where the body will start to drain it itself. And that's what a ruptured eardrum looks like. And many times it can cause hearing problems because it develops scar tissue on there. And then just like the skin on a drum, you know, it doesn't have that nice elastic top. It's got more scar tissue in it. All right. Now, when it comes to ear tubes, this is what an ear tube looks like. So doctors will then surgically put an ear tube in, and once again, this is the medical approach we're talking about now. They will surgically put an opening in the tube, in the hole, and put a tube in, like a small little tube. Sometimes they're metal. The metal ones are the more permanent ones, or they're these plastic ones. Young children, and this is by Robert Stenstrom at St. Paul's Hospital in Vancouver, young children randomly assigned to receive ear tubes or to be treated daily with antibiotics reveal that those with ear tubes experience significant damage to their eardrums compared to antibiotic group. In fact, what they end up saying is this: additionally, the tubes were connected to poorer hearing 6 to 10 years after they were removed. So not only are children just getting tubes almost indiscriminately, secondly, when they do put the tubes in, it's causing impaired hearing or hearing problems between 6 to 10 years after they're even removed. So it's creating problems in the long term, which is not what you want as a parent. In fact, Dr. Stephen Berman, professor of pediatrics at the University of Colorado and Children's Hospital in Denver, said medical guidelines are confusing. Put tubes or not put tubes. That children needlessly get tubes in their ears on a regular basis. So once again, tubes aren't the answers, guys. Don't just keep putting Band-Aids on the problem. That's not what it's about. We're going to get to the causes of what's creating this problem today and actually give you a better solution to it. And then lastly, many times they start to look at tonsils and adenoids, like Matt had. Tonsils and adenoids are being an issue, so maybe we should just take those out. And as we talked about in the beginning, your tonsils and your adenoids are your body's first line of defense against bacteria and viruses and funguses as they come in right through the mouth. So we need our tonsils and adenoids. In fact, many children who, when they come in with tonsil and adenoid problems, they might be swollen to where they're blocking the breathing canal or their throat. With what we do in our office, it actually causes them to recede, and they actually go back to regular size. Because they are lymphatic tissue, they're going to swell when they're encountering different bacteria, microorganisms, funguses and mold and things like that. So they're going to be swelling because they're constantly fighting something. But if we then go and compromise the child's immune system more, all we're doing is creating more of an issue. And then they're going to want to take the adenoids and tonsils out. Now, I know a lot of kids today are thinking, well, that's pretty good, I get to eat ice cream. But that's really not what it's about. It's about making sure their body's healing and healthy from the inside out so that way they can fight these infections better. So let's get into this now. What really causes infection? And this is a key thing. This is where it really comes down. This is where that rubber meets the road, guys. This is where we start to figure out what's actually causing these problems. And by the way, if this is making sense, like I said, please like it, share it, give it a heart thing, but most importantly, share it with your friends, because there's people who maybe have a child suffering in Minneapolis or somewhere in St. Louis or somewhere else in the country that, you know, they can't get to our office, but we can help find them someone in their area that can give them the help they need. Or maybe just hearing this video, they can then seek out the help they need. So please, guys, like it, share it, and get it out to your friends. So what really causes the infection? Well, a lot of times we're thinking, well, maybe it's because of swimming. You know, swimmer's ear, we actually have a term for that. So maybe there was bacteria in the water, and maybe the water in the dirty water got into the child's ear and created the infection. Well, let me ask you this. If that was really the cause, all right, wouldn't everybody in the pool that day, whether it be 100 kids, 200 kids, 400 kids, or before they even did a water change or a chemical change to the water, wouldn't everybody that was in that pool get an ear infection? Think about that. But you can have maybe 3 or 4 kids, and one of them gets an ear infection, complaining about it. The other ones are thinking, I noticed nothing about the water. I was fine. So we can't keep blaming the bugs, the germs, the bacteria, the viruses, the fungus, all these different things. Because if that was the case, everybody would get it. So everybody would have been infected once they were in the pool. In fact, a lot of times, you could be around other people who have illness. Maybe a child has a pneumonia or a cold or a virus or something, and you're thinking, am I going to get it? Oops, hold on, let me check my phone here. Am I going to get this or not? And the reality is you won't, because your body's own immune system fights it. So it's not the germs and the bugs that make us sick, it's our body's resistance to them. So we're going to get into that in just a moment. So if we had a situation like this, we have a dumpster. And in a dumpster, we have all kinds of rotten food. So we start to get rats coming around the dumpster. Now, let's look at a scenario in 2 different ways. One, did the rats create the garbage, or did the garbage draw the rats? Which is it? Well, of course, the garbage, the rotting food, the things we threw inside the dumpster, created an environment that draws rats. And that's the way it works, guys. The rats didn't create the garbage. But yet in our society, we believe the germs created the disease, when it's the exact opposite. What happens is the cells in the body become diseased, and the bacteria show up because they are garbage disposals. They are nature's perfect garbage disposals. That's the way God designed it. So because of their ability to break down materials, break down food, break down an animal that's maybe in the road, they're the best garbage disposals there are. Otherwise, they would just sit there on the side of the road. So let me give an example. If I did this, if I had my hands right next to each other, and on this hand, my left hand, I put a tourniquet around it, and that tourniquet started to cause my hand to go numb, and then within about a day or two, it was starting to get lifeless, and within a week or a month, it started to decompose, and my hand was decomposing, and bacteria were there, and it smelled, and it had all kinds of oozing stuff all over it. What if my other hand was right here, and I had my 2 hands right next to each other? Clearly, the bacteria from this hand can jump over to this one, but is it going to make this hand a problem? What do you think, guys? The answer is no. It's not going to do anything to this hand. This hand is healthy and fine because this hand is healthy cells. This hand has the diseased cells. And because the diseased cells are attracting, because of their frequency and their wavelength, they're attracting bacteria to them, the bacteria will decompose this hand, but not this one, even though they could be this close together. I remember a number of years back, this is probably 10 years ago, watching one of these, educational shows like Nova, and they were talking about this guy who had chronic infections in his heel, and the doctors couldn't fix it. They didn't know what to do. They didn't know how to keep the sore clean. And it was gross. I'm telling you, what they showed on camera was pretty gross. But what they did was this. They packed it. Okay, get this. Now, this is It's going to sound gross and scary. They packed the sore in his heel with maggots. I know, don't throw up. They packed it with maggots and then put gauze bandages all over it. And what they did was they let the maggots do their work. And the maggots ate all the dead tissue inside the guy's sore. And then when they went in and washed and cleaned all the maggots out, all they had was clean tissue. The maggots will not eat healthy tissue. The maggots eat the decaying tissue. The maggots eat the diseased or weakened tissue. Guys, you got to get this because the same thing happens in the ear. Bacteria attack weakened tissue. They don't attack healthy tissue. So what's causing the weakness? What's causing the weakness to the tissue of the ear, the cells of the ear, that then make it a breeding ground or attract bacteria? Because bacteria are just coming around. Now, if we just take antibiotics and kill the bacteria, that's the equivalent of us just setting rat traps. We'll just keep setting rat traps. Should we set traps for the rats or should we dump the garbage? What do you think, guys? Set traps or dump the garbage? What's going to fix this problem? Well, obviously, dumping the garbage, cleaning this area up to where we get rid of the garbage and then we don't have to attract any more rats. Let's see if there's any questions here. You like the maggot analogy, huh, Adi? Very cool, very good. Excellent. Anyway, but it's true, and it's a great analogy because it really just, unfortunately, graphically depicts what's going on here. So with that said, we have to figure out why is there damage to the inner ear that's attracting bugs, that's attracting bacteria. And by the way, this doesn't just apply to the ears, this applies to the lungs. What if you have weakened lung tissue? Well, now you've got infection developing in the lungs. We can call that a bronchitis or a pneumonia. So once again, we have to figure out what's causing the blockage or what's causing interference to the life in the lungs. What if there was a problem in the intestines or the colon or the bladder and there's an infection there? Well, the infection just means that there's something that's blocking or creating weakened tissue there. We can't keep taking antibiotics, especially the kind that just basically are nuclear blasts to the whole body. We've got to figure out what's causing the weakened tissue. Does that make sense? Yes. So, where it starts with a baby or with your child is at birth. Okay, now I'm going to show you a picture that's pretty graphic, but it really shows what's going on here. And this is just one way it happens. Well, what we see here, here's the doctor's hands, here's the baby's shoulder, and here's mom over here, and that baby's being pulled out. So that doctor's got his hands right around that baby's neck, and that doctor's pulling. Now, think about this. The first time you ever held your child, if you're a parent out there, the first time you ever held your child, did you just hold him by the head? Hand him off to your husband, hey honey, look, we had a baby girl, and just hand off the baby? Or, oh doc, look, we get, thanks, hand me my baby, doc. No, you'd never do that. You'd always cradle the head. In fact, typically when you're handing the baby off to a family member, especially a newborn, you're cradling the head and neck. Oh, be careful, be careful. Here you go, here you go. And you're being so careful not to let the head and neck flop around. But why do doctors pull when they're birthing a baby? Now, we can get into a whole different discussion about this as to how they're birthing it and not using gravity and instead putting a child or a mom on a table where the baby then has to, if you guys can see this okay, come up and over the tailbone instead of putting the mom in a squatting position where the baby comes out right here. Instead, the mom has to push the baby out up and over a tailbone. That's one problem. But what ends up happening is this doctor has to then pull the baby out. Or if they give the mom an epidural. Well, now the mom's uterus is basically going to sleep. So now they got to pull the baby out. So what they do is this. They might use a vacuum cup. A vacuum extraction where they pull a suction cup right on a child's head and pull that way. They might put forceps on a baby's head. Now, forceps pull with about 90 pounds of pressure per square inch. Well, it only takes about 110 to cause decerebration. Decerebration means the brainstem can actually be pulled from the brain. Well, it only takes about 130 to pull a baby's head off. So if you're pulling with about 90 pounds of pressure per square inch because of a forceps delivery, and you're pulling out with these big giant metal tongs, what do you think you're doing to that child's neck? You're creating massive upper cervical damage in a child's neck. And there's been tons of research on this that shows when you damage the upper cervical spine, you damage breathing, you damage the ears, you damage the throat, you damage their immune system, you damage a whole lot of things. So pulling on this child's head and neck is creating all kinds of issues here. So what we see then is we see damage to the upper cervical spinal nerves. When there's damage to those nerves, it creates the ear problems because the nerves are supposed to be telling the body how to work. And now you have damage in that area, upper cervical spine specifically, right here. So if you touch the back of your skull and come off right here to that soft spot, that's exactly what I'm talking about. Or if you drop right here, just behind your earlobe, that's what we're talking about right there. When you damage that area, you create a whole host of health issues, especially ear infections, tonsil problems, sinus problems, adenoids, sore throats, strep throat. So if you have a child with recurrent strep throat, with recurrent ear infections, sinus problems, headaches, that's where it's coming from. I could tell any parent when they bring their child in to see me, and I've been doing this, like I said, for 26 years, I start checking out their child, then they tell me their child, and I find problems up here. I said, even before they tell me, has this child been having ear infections? Yeah. How's their sinuses? Well, that's a problem too. Or what about their throat? Do they get strep throat a lot, or do they get sore throats a lot? Yeah, quite a bit. Or they've always had this or that. I could always tell because when you find a problem there, you start predicting what they're going to have wrong with them. And they might not have all of those things. They might have one or two of them. But still, you're now finding the cause of their problem. We had a lady come in her 70s just about a month ago, sign up as a new patient. And when she came in our office, she was telling me she was just about to go have another procedure done to get her sinuses surgically repaired. But she didn't think it would work because it typically only works for about a year, and then she has to have it done again and again. She said, I don't even know what to do anymore. I don't want to go have this procedure done, so you're my last resort. So she was referred in, started adjusting or started working with her, correcting the upper cervical spine. On her very first visit, within seconds after her first treatment, she said, should my sinuses be draining already? They're actually draining already. And I said, of course they drain right away. And since that day, she's had no sinus issues and no headaches. Now she's going into the holidays happy because she's going to finally feel that she's got her life back. And she's so grateful. But somebody should have told her about this a long time ago because that upper cervical spine affected her sinuses just like it affects the ear infections that we're talking about with these other patients. Because what it does is it creates something we call vertebral subluxation. And vertebral subluxation means that the nerves in the neck right here are being pinched. And when those nerves are pinched because the spine misaligns, hold on, let me find my spine here again. So when the spine misaligns and these bones misalign out of position and pinch the nerves in the neck, it affects how the ears function. And now, instead of getting proper function to the ears and making proper cells and proper, vitality and energy, instead the cells are dying off. Just like if I block my hand again. If I put a tourniquet right here and I block this off, I'm now blocking off life to my hand. Cells become damaged. My hands start to decompose. Every patient I ask this, I say, what's going to happen if I do that for 10 minutes? And they're like, well, it'll go numb. What's going to happen if I do this for 10 years or 10 days or 10 months? They're like, well, it's going to rot off. Well, if it rots off, first it's got to go through decomposition stages, which means that bacteria eat it. And then we're going to spray it with, antibiotics or give it antibiotics cream or lotion. Is that what's going to fix it? Or is it taking the pressure off and letting life back into the hand? That's what fixes it. So we don't need to be taking antibiotics, putting holes in someone's ears, putting oils on them and all these other things to just mask the symptoms. And although it makes your child feel better in the moment, and believe me, as a parent, I've got 5 children, I understand that. You don't want to be waking up in the middle of the night with your child. But we've had so many children that we've gotten better this way because by aligning their spine better and taking the pressure off of their nerves so that way their nerve system works right again, sending the proper signals to their ears and the other parts of their spine and body, their body heals and it functions the way it's supposed to. So when we make an adjustment, this is what it looks like. This is me adjusting a small child. Now when he comes in the office, we check his neck, we gently palpate, we feel around to see what bones are misaligned. This is already after taking x-rays and doing a thorough exam. And once we find out where the improperly lined segments are, the ones that are misaligned and putting pressure on nerves, we deliver a very gentle adjustment that aligns the spine better. And some of you maybe experience this. I know a lot of the people on the line right now, you've been either patients of mine or you've seen my stuff before. I had a lady come in the other day, it was so great. She goes, I watch your videos all the time. I'm like, wow, how do you know about me? So it was pretty cool. I was really kind of honored. And I was like, wow, I get to see you in the flesh now. And so it's really neat. So some of you have seen what we do before, know exactly how it works. But some of you who don't, you want to seek out a chiropractor in your area. Now, I have nothing to gain if you're not in my area, but I want to help you to be able to get your child and your family healthier by getting them checked out. So please, find a chiropractor in your area, a reputable one, because I'll be honest with you, we're not all good sometimes, but you want to find a good one because you will get your life transformed. You'll get your health transformed. Your child will be healthier. Not because of anything that's masking it, but because they've released the pressure to allow the nerve system to work the way it's designed to. So guys, if you want more information, you can email me. You can get in touch with me. Here's my information right here. You can email me at live@drsedano.com. It's right up there. And if you want me to find you a chiropractor in your area, I'd be more than happy to. And guys, one more thing about it, it is safe. My malpractice insurance is about I think it went up to a whole $1,200 a year now. $1,200 a year. I pay less than probably most landscapers. And I've got the highest coverage you can have, $3 million coverage. But we don't hurt anybody. Nobody gets hurt going to a chiropractor. So guys, to put you at ease, it's safe, it's effective. Have a chiropractor check out your child's neck, cervical spine. Make sure they take a full set of x-rays and see exactly what's going on so that way they know exactly which bone is putting the pressure on the nerves, how it's aligned, how to realign it, and how to make corrective care adjustments. And make sure your chiropractor is a corrective care chiropractor. That's critically important because you don't want just someone who just moves bones and racks them, cracks them. You want to make sure it's a corrective care chiropractor. So if you want more information, give me an email, let me know. And if you liked what we talked about today, like it, share it, give it the heart, but the most important thing is to like it and share it so that way more people can see it. That way it can really get out to the rest of the country or the world for that matter. So also too, if there's anything you want to know about, put it in the comment bar. We're always about making sure that the shows are for what you guys like. So put in the comment bar maybe some health topics you'd want us to talk about. I'll be more than happy to create a whole show about what you want to know about. So if you have other health issues or health concerns, let me know, put it in the comment bar and say, hey, Dr. Nick, do a show on this. I'd love to see a show on that, and I will do it. So I appreciate it. Thanks for your comments. Thanks for being here today. I love and appreciate you. God bless. Have a great holiday, and watch out for our next shows. In fact, you can even follow us. You can click one of those little follow buttons there, and you'll get notified whenever we're on the air. And hopefully we, number one, spoke truth, and number two, made it simple for you. So that way it's easy to understand and you can make your best healthcare decision. So once again, guys, thanks a lot. I appreciate you being here. God bless. Have a great holiday if I don't see you. Appreciate it.